Hello, hope everyone's having a good day today. I want to welcome you to the 8th episode of the Local Okie. We are back at 405 Vet Animal Hospital. They're going to be discussing some tips and tricks about dentistry. And if we haven't had the chance to meet, my name is Jimmy Jenkins. I'm the owner of J&J Medicare Solutions, which is an agency that specializes in helping boomers and seniors to understand their options with Medicare. Also, I am the host of the Local Okie, which gives me just a great excuse to go out and talk with some awesome people. And so, again, I want to apologize for being late. We had a surgery that took a little bit longer than expected. But again, I'm excited about what Jared and Jesse, they're going to teach you guys today. Also, if you have questions, put it in the comments, and Jared and Jesse will answer those at the end of this broadcast. So from here, I'm going to turn it over to Jesse and Jared. You guys, thanks for being on the show.
Absolutely. Thanks for having us, Jimmy. We just want to thank Jimmy and thanks to the Local Okie for coming to hang out with us today and doing this video. The Local Okie has some pretty sweet equipment here to help us shoot a really good video. So we appreciate Jimmy coming out and the Local Okie and helping us promote our new business and talk about dentistry and pets. This is the second video we've shot over dentistry. But February is Pet Dental Health Month. And so that's kind of why we're promoting dentistry this month. We actually have discounts on dental procedures and dental products this month. It's a 10% discount, so holler at us and we can discuss that a little bit further in detail. But kind of what I thought we'd maybe talk about today is just the dental cleaning procedure. And, what we do when you bring your pet in and leave your pet here for a dental cleaning. What we do and why it's really important. Of course, most pets out there aren't getting their teeth brushed every single day like we are, and so their teeth get nasty, their gums get infected, their breath gets really bad and stinky. And so that can really have serious detrimental effects on their health, especially as the older they get and the worse it gets and the longer it goes on. All from not having their teeth brushed, all this plaque and tartar build up on their teeth. And, you can basically kind of look at plaque and tartar almost like mineralized bacteria, and it gets on the tooth and it gets under the gum. And then those tissues, the gum tissue and the bone around the tooth actually get infected from that bacteria. And then, basically the immune system is responding to that infection, all the time. 24 hours a day, 7 days a week, 365 days a year. The immune system is reacting to that. And when we have all that bacteria and infection in there, often that bacteria gets over into our blood and it can travel. And hopefully the immune system responds to that bacteria in the blood very quickly. But they've actually determined that pets with all this infection in their mouth, it has chronic degenerative effects on almost every organ in the body. And for example, there's studies where pathologists have looked at liver tissue, kidney tissue, splenic tissue, just tissue from literally every area of the body. And pets with periodontal disease, they see chronic degenerative changes in those organs. Compared to a healthy pet without infection in their mouth, they have a lot healthier organs. So literally the infection in our mouth just affects overall health of a pet throughout their life. And so during Pet Health Month, we want to, of course, we're always promoting pet health, but this month we're really promoting dental health, things you can do to prevent infection in their mouth. And we're just trying to, create, healthy pets and try and improve and prolong that human animal bond. Really stinky breath can really affect how much you can enjoy your dog. It's hard to enjoy your dog as much when they're knocking you out with that stinky breath. But anyways, back to the dental procedure. A lot of pets aren't getting their teeth brushed every day, so all that stuff builds up in their mouth and their mouth gets infected. And so one thing we can do to help decrease that infection is we can bring them in and we can do a dental cleaning. In pets, when we do a dental cleaning, it's a lot like when a person goes to the dentist. Except, one big difference is obviously a pet's not going to sit there and hold his mouth open for us to work. And so what we end up having to do is we end up having to do general anesthesia. And we have to just completely knock them out so we can get in there and clean up their teeth. We use a lot of the same equipment that a dentist uses. We use a dental scaler where we go in and it knocks all that plaque and tartar off of there. Another big reason that to do a good cleaning and a thorough cleaning, you have to have general anesthesia because a lot of the plaque and tartar gets under the gum line. And actually that is the plaque and tartar that does the most damage. Because when it's under the gum line, that is what causes the most inflammation of the gums, and it actually gets in contact with that bone and causes the inflammation of the bone. So with them anesthetized, we have a small little tool that we can clean out under the gum line. And so with anesthesia, you can do just so much better job cleaning those teeth. But yeah, we bring them in, and every animal, we give them a sedative that makes them kind of sleepy. Once we get them kind of sleepy, we put an IV catheter in. We have a medication called propofol that we give them that actually will knock them out and get them into a surgical plane of anesthesia. We pass an endotracheal tube into their larynx and trachea, and then through that trachea tube, we can actually administer an anesthetic gas. And that anesthetic gas actually keeps them out. And so once we get them, completely anesthetized and start delivering that anesthetic gas, what we come in and do, and this is probably my favorite piece of equipment in the new clinic, but what we do once they're under general anesthesia is we come in and we use this little contraption. This is a dental x-ray machine. And, it looks a whole lot like the ones that the dentist uses on us. But, I like this thing a lot because we can just do so much, and we can just really thoroughly evaluate everything that's going on in a dog's mouth. Dental x-ray is something that some veterinarians have started to invest in, I don't know, probably the last 5 or 10 years. And it totally just helps us do a much better job and thoroughly evaluate the mouth. So yeah, basically what we do, let's see the little skull here. We come in here, and this is a dental x-ray machine, so we get dental images on the computer in just a few seconds. It just pops up a quick digital image. Thank you. Yeah, once we get the pet anesthetized, we're able to come in and, this is our anesthetized patient. And this is our little dental sensor. This thing is really cool. It doesn't look like much, but this thing is almost like it's like a piece of x-ray film. This little thing literally goes in the mouth while they're anesthetized, and we basically put it back here behind these teeth and behind the tooth roots, and then we take this dental machine, if you can kind of see this here, and don't let me knock you out, Jesse. We shoot these x-rays down through the tooth and through the root and even through this bone up here, and the x-rays pass through the tissue and hit this little sensor, and literally in a few seconds this image pops up on the computer screen. And I don't know if you can see that very well, but the image pops up really quick, and we can just evaluate everything. You know, the crown of the tooth, you know, we can see, and so we don't really need the x-rays to evaluate the crown, because you know, that's the part of the tooth we can see when we open the mouth. This helps us evaluate the bone, and it helps us evaluate the tooth. And so we can just know everything that's going on in there, and literally, you know, I don't know exactly what the figures are, but there is by far more pathology underneath the gum line that you can't see when looking in the mouth. There's by far more pathology underneath the gum line than what there is above it. And so, for example, I don't know, Jimmy, if you can see this dental x-ray right here, but you know, this pet just came in and just had some plaque and tartar on its teeth, and I totally thought we were just going to, you know, scrape off the plaque and tartar and polish and be done. But what we did once we got in there, once we did an oral exam, we noticed there's a tooth missing right here. And these big lines right here are actually the endotracheal tube. But there was a tooth missing right here. So the big question is, you know, did that tooth just fall out? Did that tooth never come in? Did it break off? You know, you don't know unless you do dental x-rays. And as you can see, the tooth right here, there's a retained tooth root right there. I don't know if you can see it or not, but there's a retained tooth root, and that tooth is obviously dead now, and that's almost like a foreign body in there. The immune system responds to that. That thing can abscess in there. It can cause destruction of bone. It can cause pain. I mean, you can only imagine how painful that would be if a person had that. It can cause pain, you know, and so recommended treatment for that is to go in there and get that root out of there so it doesn't cause a problem in the future. It might, you know, a pet might go several years before there are symptoms that are noticeable or symptoms that are obvious. And by the time those symptoms become obvious, a lot of damage and a lot of destruction has happened. But anyway, yeah, and something else that we can see on here is this tooth right here, the one in front of it, looked pretty good, you know, when looking at it just in the mouth. But right here next to it, this bone in front of it, there's destruction of all that bone right there. And so what has happened right there is a little bacteria has gotten under the gum line and a little infection has developed right here. And that infection has just progressed and gone deeper and deeper and deeper. And all this bone has been destroyed right there. And so, you know, what happens, and really the recommended treatment for that tooth is just to go ahead and extract it. Because what happens if you don't notice that on dental x-ray, and you just come in and clean it and send the pet home, that infection just persists. That bone continues to be destroyed. It continues to cause pain. And then as soon as the dog starts eating again after the dental, food starts packing into that pocket around the tooth, and just destruction continues to happen. And if it is allowed to get worse, the next thing you know, you have a big swelling on the side of the dog's face and a big giant abscess. And so when you find pathology like this, it's much better to get it taken care of as soon as you find it, instead of waiting years for more damage to be done and waiting until you have a much bigger problem on your hand. But dental x-rays just allow us to see so much. we can see how much bone loss there is. We can see, retained roots, abscessed roots. Sometimes you'll have pets where, like obviously on this dog, the tooth came in and it broke off and there was just a root retained. But sometimes you'll have pets where the tooth becomes impacted and it never even erupts and never comes in. And then you have this adult tooth that's sitting back here in the bone, and it can cause a big cyst in the bone and cause major issues for the pet. And so if that stuff is caught early, it's a lot easier to do something about it. It's a lot less expensive to treat, as opposed to waiting until it's a lot worse and becomes a lot more expensive to treat and a lot more difficult to treat. But anyways, that's kind of my new favorite tool that allows us to do so much and really just allows us to take excellent care of your pet. And so I'm super excited about that thing. Too, when we do a dentistry, at this point we identify any pathology in there, and if we have to do extractions, what's really cool is, if you look on this skull, these little holes right here and up here, those little holes are basically called a bone foramen. And what comes out of those little holes are veins, arteries, and nerves. And these are the nerves that come in here, and actually you can even see inside the mouth. If you look back in here, there's another one. There's a nerve that comes out of there. And like for example, this nerve here innervates and is sensory to all these teeth right along here. And this nerve here is sensory to these teeth. This nerve here is sensory to all these back molars on the mandible. But if we have to do extractions, what we can do is we can come in here and we can stick a needle. We can fill those little holes, and we can stick a needle right there next to that foramen and inject local anesthesia. Local anesthesia, the most common one used that people know of is lidocaine. Well, lidocaine just numbs those nerves. That way we can work and this pet's not going to feel a thing. We actually don't use lidocaine because lidocaine doesn't last very long and only lasts about 30 minutes and then it wears off. We actually use one called bupivacaine, and bupivacaine lasts about 8 hours. We actually, there's bupivacaine. We'll actually use bupivacaine and mix it with a narcotic drug called buprenorphine. And when you mix bupivacaine with buprenorphine, there's studies that can control pain in that nerve for up to 96 hours, which is days. That's a really long time. And so that's what we use. And so literally your pet, if we have to do any extractions, any dental work, pet's not going to feel anything for days and days. And so that's always good to know because it makes people feel a whole lot better about the work we're having to do. Because that's probably the number one question I get from clients concerning any condition. What is my pet in pain? And so that is always our number one goal here, is to prevent pain. And so if we have to do extractions, we can take care of pain. Let's say we get in there and the dental x-rays all look good. So then we just take your pet over, and with the same fancy dental tools that your dentist uses, we just clean these teeth, get all the plaque and tartar off, clean under the gum line, and that's basically it. My experience, I think what a lot of people have always thought, once a year dental cleaning, if they spend the money on once a year dental cleaning, their pet's gonna be in good shape and maintain their teeth for a long time. My experience, that's not really the case. We recommend a once a year dental cleaning so we can get in there and clean them and do the dental x-rays and pick up on any pathology, early on in the course of that disease process. But I totally recommend that you do some preventative care at home as far as cleaning teeth and preventing plaque and tartar. Best thing you can do is brush your pet's teeth. Sometimes that's not possible. Some pets just aren't going to let you do it. And so there are some alternatives to brushing teeth, although they're not as good as brushing teeth. There is OraVet chews. These are chews that really can help prevent plaque and tartar and bacteria adhering to the tooth. All this, this stuff's 10% off this month too, but these are great. There's also a dental food. This dental food is a little bit different texture. It's a little bit different consistency. There's some enzymes in there that help prevent plaque and tartar. And so I think it really can make a really big difference. Although, I always like to stress, these products are not as good as brushing teeth. So I highly recommend brushing teeth if you can get it done. These are alternatives or can be used in conjunction with teeth brushing. But that's kind of your dental procedure, in a nutshell. Usually what we do the X-rays, and if there's additional work that needs to be done, we call the owner and talk to him about that additional work. Could give them an estimate on that additional work, and we get it done. Dentistry has kind of become a new passion for us here. We're really enjoying, helping promote better oral health in pets, and I think it makes a big difference in their overall health. It's totally going to help them live longer. They're totally going to live their life in less discomfort. And it helps you enjoy your dog a whole lot more when they're not knocking you out with the nasty teeth or nasty breath, excuse me. But anyways, that's really kind of all I had to talk about today. Jesse, is there anything you wanted to talk about? Jesse is kind of she's my number one dental tech. She's the one that does all the dental X-rays and does a lot of the cleanings. The other girls do a lot of the dental cleanings also, but I've kind of put Jessie in charge of my dental X-ray machine, and she takes good care of it and gets me really good images, good diagnostic images, where I can really see kind of what's going on. But we can't stress the importance of dental health care, and pets, pet owners, if they had a big infection, if they found a big infection somewhere on their pet that was, the size of a softball, it'd be a really big deal. They'd want to get that infection taken care of, or that abscess. If it was on the dog's side or the dog's leg, they'd very urgently want to get that taken care of. But for some reason, when there's a big infected area in the pet's mouth that involves about that much tissue, it often, people don't seem to worry about that quite as much, but they should. And so we're just trying to bring awareness to that and help pets be healthier. But Jesse, do you have anything you want to talk about or bring up?
Well, I can't really brush my cat's teeth, so what should I do about that?
Yeah, cats are tricky. Cats are real tricky. Brushing your cat's teeth, it's important to start, cats or dogs, any of them, out at a really young age. Just when they're young, it's so much easier to get them used to it and train them. Cats can be tough though, because they really want to fight you. You got to be careful and not get bit. Cat bites can be nasty. But anyways, you just have to lift their lip and get in there and brush. Cats, you can't be very aggressive, because cats they'll take off on you and scratch and get away from you. So in a cat, you got to be a little bit more gentle than what you do in a dog. Cats like to get those paws up there and scratch, and they'll push against your body as you're trying to hang onto their head. You can always take a towel and wrap it around the cat. We call it a kitty burrito, but you can make a little kitty burrito, wrap the towel around them, and that kind of helps control their legs. And that controls their legs, and you just can control their head and just be real gentle. Those are kind of some tips that I've found that have kind of helped me a little bit. But same thing. Cats need the same things that dogs do. Cats get the exact same periodontal disease. And so cats need yearly dental cleanings also, and yearly, dental X-rays to fully evaluate everything that's going on in there. So, that's a really good question. Anything else?
Not that I can think of.
Jimmy, you have any questions?
Man, I think you did a great job. I think you've covered everything.
Well, I hope I explained it. I hope it makes sense. But yeah, it's our new toy that we're having a lot of fun with, and we're real happy with it because we totally feel like we're doing just a good job diagnosing things, preventing pathology in the mouth, finding pathology, and we just feel like we're doing a better job, a really good job of just treating dental disease and preventing dental disease, and so it really helps us accomplish our goal here.
Awesome. Well, thank you so much for watching another edition of the Local Okie. If you have any additional questions, please put it in the comments. We'll be checking it from time to time to get those questions answered. So, any final thoughts?
No, watch us again soon. We're going to try and do these, every month or so. So be on the lookout. Watch the Local Okie.
Happy cleaning.
Happy cleaning.